So we're gonna do some Kybella today, which is deoxycholic acid injection, same type of chemical that's found in the gallbladder, which helps break down fat cells. And we already marked the patient and we put her little grid in here. We're only doing one vial today, so we're gonna stick with injecting that more centrally where she has a little bit more submental fat. See the little dots, marking the mandibular bone here, hyoid process, and then the border of the sternocleidomastoid. We are going to, I usually like to stay away from these few little dots right under the mandible where the marginal mandibular nerve exits and becomes more superficial. So I usually will inject this area here, and then I go down one as I move laterally here, and then normally you do about 0.2 per injection. Sometimes I'll do 0.2 to 0.3 cc's where the patient has more fat, and then I'll fan out with 0.2s and 0.1s in the more lateral aspect where she has less fat. So we are going to use a 30 gauge needle to inject. I'm just gonna dab her with a little bit of alcohol. I'm gonna raise the bed. And grab a little gauze here. And I like to move this out, going in, inject about 0.2 to 0.3, going to the next one, 0.2 to 0.3, going to the next one, so are you okay? So basically right along the center here we did 0.3s. Starting to burn a few minutes after. You're gonna get more swelling, a little bit of pain, a little bit of numbness. Sometimes you might even feel like a hard little ball. So then we're going to the next row. And we can do 0.2s here. And we can do 0.2s here. Same thing here. And then here we can even go 0.1. And it's really important not to, inject too superficial so that you don't injure the skin. It's a little uncomfortable. She's holding it all in for the video. So you're starting to see a little bit of redness there. Oh, maybe we'll kind of just 2 more little injections. Don't want to miss out on these. Right. So we did a little bit in here. And then we can do another one out here. And that's pretty much it. And we're gonna give her some ice. And just kind of ice the area. Let me put this on here for you just so it doesn't get too frozen. So we're just gonna ice the area. We're expecting a lot of swelling, kind of like a double chin. So this is something that you have to kind of socially prepare for. And then takes about anywhere between 1 to 2 weeks to improve and go down. And then about, I would say closer to 4 to 8 weeks. The closer you're at 8 weeks, you're gonna really appreciate the full results of the treatment. This patient already did a couple vials last time. This is her 2nd round of Kybella, and definitely seeing some results. So hopefully we get that last little push. Thank you.